This is the only subspecialty or specialty that I thought of that you can handle the person from birth till the end of their lives. Okay, so from childbirth until they become adolescent, reproductive age group till menopause. So see, we have a very unique role as OB-GYN too, because we are the first one to be able or given the privilege to touch the baby. And you can speak forth blessing to this child once you pull the baby out of the mommy's tummy. So I think this is something really unique and very special. And we can touch the women's lives from birth till the end. There are a lot of experiences. I have been practicing for 32 years. So I had a lot of trophies, I would say, because you see, very challenging sometimes, especially when on labor, the baby is in distress, so you have to rush to the operating room to deliver the baby. I would say more than 24 hours, the patient is in labor and delivering an 11-pounder baby, just imagine. So, you know, I have just to, with all energy and strength, pull the baby out from the mom. Every patient is always a challenge. It could be a short labor to the longest labor. Every patient is a challenge to me. So every time, even if I'm doing this for the last 32 years, I have to always pray for the safe delivery of the mom. And of course, my happiness is to have a healthy baby and a healthy mommy. I'm a technology-forward doctor, so I make sure that I always go to study, and learn advances in technology. I am one of the pioneers of the robotics surgery, gynecologic surgery. This is so good because it empowers women who have diseases in their uterus and has to be operated on. They can do the surgery 2 days in the hospital, out of the hospital in 1 to 2 days' time, and sometimes ambulatory, less than 24 hours, they go home. And after a week or so, they're back to their normal activity. So that's one thing good with robotics, because you have small incision, less scarring, less complication, and the most important one is that easier to resume their normal activities. I also do aesthetic gynecology. I'm also one of the pioneers of aesthetic gynecology here in the country. This is something new in the Philippines. In the other parts of the world, they had been practicing aesthetic for a long time, but here in the Philippines is something very new.